SAHMRI acknowledges the Kaurna people as the traditional custodians of the Adelaide region, where our buildings are located. We recognise the Kaurna people's cultural, spiritual, physical and emotional connection with their land. We honour and pay our respects to the Kaurna elders, both past and present, and all generations of Kaurna people, now and into the future. We acknowledge all other traditional owners who live across South Australia, with a special thanks to those whose lands we visited in the production of these videos. This video has been made for general information only and should not replace medical or professional advice. Speak to your health practitioner if you have any questions related to your health or medical condition. The South Australian Aboriginal Chronic Disease Consortium does not specifically endorse any medicines or treatments described in this video. Aboriginal and Torres Strait Islander viewers are warned that the following video may contain images and voices of deceased persons. There are many different types of medicines that treat diabetes. These medicines help your body to keep your blood glucose in the target range. It is important that you know your blood glucose targets. Blood glucose targets are specific to you and your type of diabetes. Another word for blood glucose is blood sugar, or just sugar. People often need to take more than one medicine for diabetes, especially as time passes. The longer you have had diabetes, the more help your body will need to keep your blood sugar in target. You might also need other medication as well, such as for blood pressure or cholesterol. It is very important to know what your medicine is for and how to take your medicine safely.
For some people, that's medicines you take by your mouth, so oral medications, but some people require insulin or injections that can help control the amount of sugar that's circulating in your blood. And we're very clever in medicine. There's lots of ways we can use these medicines to reduce your sugar. Some increase the amount of sugar your muscles can pick up and clean out of the system. Some increase the amount of good stuff that comes out of your liver to get rid of all of that sugar from the rest of your system. And other medicines can change the way that food in your stomach increases the amount of natural hormones that you have to mop up or better manage the sugar in your system.
Taking your medicines is a very important part of your diabetes management. It is easy to get medicines mixed up, but your health professionals are there to help you understand these medicines. Don't be ashamed to ask as many questions as you need.
When you go and visit doctors, doctors tend to talk to you in whatever the medical language is, and many Aboriginal people fail to understand or misinterpret the diagnosis, what the doctor's giving them, or the name of the tablets that they're giving, you know, and they also get mixed up with the timing of the tablets, you know. How often do you take it? You know, what time? You know, when? You know, it's either before meals or after meals, or you take it in the morning, or and also the problem is that if you miss out taking your tablets, what effects happens there, you know?
With my diabetes medication, I don't know, I think I've always been a bit of a slow learner. I haven't really got things first off, and I'm often sort of saying to people, you know, I need that explained to me a bit more.
We know that lots of people really struggle to get on top of their diabetes, to control it well, and it's really important that you have a good relationship with your doctor and healthcare team so that we can support you as best we can to manage this condition and stop the complications before they develop.
Fabian, Reggie and Tiani share their experiences of working with their health professionals to get their medicine balance right. Sometimes it's not easy and it can take time and patience.
I sat down with the doctor and had a talk with him, and he said the best thing would be to do is take one tablet for my diabetes and one tablet for my cholesterol and one tablet for my blood pressure. So I'm pretty happy with that, and I've been taking them tablets ever since.
A couple of years ago that my dietitian, diet educator now, she wanted to try me on Byetta. It's you have it in the mornings and evenings. You have it an hour before you have a meal. And I tried that, and actually it's working, it's pretty good. Besides having that, I take another injection, it's called Lantus, and it's a slow working thing overnight. And you've got to take them, because if you don't, your level will go up high. And it's pretty good. Everything's working well so far. But before that, my levels are high, very high. And I just take heaps of tablets. And now I'm cutting back to about 4 tablets in the morning and 2 at night, along with my insulin, obviously. But yeah, the levels are pretty good.
I am on Humalog, which is my rapid acting insulin, and Lantus, which is my slow acting, which I'm on at night time. Humalog I take about 3 to 4 times a day, and Lantus I take at night time. It's really been wonderful to have people that actually sit down and look at your levels and explain to you how it works.
Medicines are an important part of diabetes for a lot of people. It's really important to know the name of your medicines and how they work for you. One of the things that might be helpful is to ask your doctor or nurse or health practitioner to write a list of your medicines. You can either have that typed into your phone, have it as a hard copy, or we can even take a photograph of your list with your phone so that you've always got that list of medicines with you.
Remembering to take your medicines can be difficult, but little reminders can make all the difference.
Medications I take, I have Metformin and 2 other tablets, plus I also have an injection once a week. And to remind me, I have a sticker on my fridge just to let me know that it's due.
Unless I've got things sitting where I can see them, I remember them. So I try to have like my insulin there next to my bed in a little container, in a cooler container. So I remember every time I get up, I've got to take my insulin, and tablet I've got to leave where I can see it so I can take it.
How can I take my medicine safely?
It's important to know the benefits and the risks of any medicines that you take. This is an important question to ask your doctor. Your doctor or nurse will be able to talk to you about the different medicines that you're on and explain to you what the benefit is and what any potential risks may be. All medicines have potential side effects, and it is important for you to talk to your doctor about any potential side effects of the medicines that you're taking. Some of the side effects might be quite mild and you'll be quite happy to tolerate those, but some side effects might be quite dangerous. So it is very important to let your doctor know if you have any side effects at all.
With blood pressure tablets, I was on too much, and it really messed with me. Made me dizzy and all that during the day. Yeah. When I went to work, they said I was just taking too many. Now I'm on insulin also every day.
It is very important to tell your doctor or health professional if you are having problems with your medication. Sometimes it takes time to get the right medicines. Your doctor can work with you to find the best medicines for you.
We have clients there that do go to the doctors and they're already frustrated because they can't express their concerns to the doctor, and to express what the tablet effects is having on him, or non-effects that's happening to him. These cases happen sort of now and then, but it's definitely needed that the medical practitioner or the doctors need to understand that he is not only the professional, that your client is a professional, because they understand their bodies and their systems, in a different format or different meaning to what the doctors diagnose.
Understanding how you store your medicines is also important. Some medicines need to be kept at a particular temperature, and certainly all medicines need to be kept out of reach of small children.
Yeah, my glucose testing thing, sometimes it's packed away, because just in case kids visit and they pick up things and touch it.
I always talk to my patients about having a medication review at least once a year. In this way, you always know you're on the right medication and the right dose. The other time when it's important to have your medicines reviewed is if you've had an admission to hospital. In this way, we're always sure that you're on the right medicine and the right dose.
What should I know? Know what your medicines are for. Have a list and take this to all appointments with your doctor, nurse, or Aboriginal health practitioner. Know the benefits and potential side effects of your medicines. Know how to store and dispose of your medicines. Know when to contact your doctor or health professional. Remember to ask for a review of your medicines each year, or if something changes. Sonia and Pauline leave you with this important message.
Take your medication, your insulin every day when you're going to take it. Look after yourself. You know, do what the doctor tells you to do.
I think that's a really important thing. You know, it's up to us, and we can have good long lives, but it's up to us to make some of those better choices and find out about what are the best choices for us, you know. So, yeah, medication is very important.
We hope you have found this video helpful. For further information and resources, check out the links on your screen now. The South Australian Aboriginal Chronic Disease Consortium would like to thank the following Aboriginal community members and health professionals who participated in this video. This suite of diabetes video resources has been made possible by funding from Country SA PHN.